can help the whole thing, can help them get better. And it's like how you said, there's treatments for schizophrenia.
Mhm.
They're learning things about how to treat people on the spectrum, etc.
Right.
Maybe it'll be that way for narcissism at some point.
Yeah. There are some psychologists that I reference in my book who have actually have treated over thousands of personality disordered individuals and have stated they have gotten some better. Few and far between. But I think the more therapists who will use this type of like verbal surgery versus processing trauma from their childhood will start to realize, well, maybe we'll increase the improvement in these individuals who are willing to come. It is still rare, because they don't think they have a problem. But the ones who do show up and commit, few and far between, but the ones who do, if you do like default to the traditional childhood history oriented therapies, they're eventually going to get bored and they're just going to leave because they're not challenged to change. They're just going to be empathized with. And that's really not what they need. And empathy is a whole nother interview, I think, right?
Yeah. We could go over some of that too, like terms like empath where that came from.
When I say empathy won't cure a narcissist, I'm not saying be mean to them. That, I guess, was my point. You can still have the natural empathy that arises in you when you're talking to any human being, but that's not the curative factor. That's not going, because empathic failures aren't what caused narcissism in the first place. So you're not going to repair it with a lot of empathy. You're going to repair it with, kind of cause and effect problem solving with them. Like, you need to convince them it's in their best self-interest that they need to be different so they'll get better results in their life. And that doesn't require them feeling anything. It just requires them behaving differently.
Right. And that's the behavior modification component there.
Right.
And I think they would respect more someone who keeps it real with them, as long as they can think, okay, this person is on my team. They're not really out to get me. And that's a big hurdle to overcome too. But if they can believe that about you and you just like keep it real with them and straight, I could see that possibly having a good impact on them.
Yeah, I agree.
As opposed to just having the super, like, oh, you came from childhood trauma, let's try to work your way through that. And the narcissistic person with low to no empathy is like, what is this?
They also are going to play with that because it's in their nature to manipulate. So once you let your guard down and you empathize with them, it's like they've got you. And because they don't attach normally, they're not seeing that as a problem. Everything's a game to them. It's about exploitation for some distorted purpose. It's really not that there's this wound, this gaping hole in them that they need to fill with love and affection. And it's hard to imagine that people are walking around like that, but it's also worse when we don't acknowledge it because it's too hard to imagine. It's like, it's not making anything any better,
Right. And people are just very different. I think people who haven't lived a checkered life, I've lived a checkered life. So I've seen people from all different walks of life do all sorts of wild things. So nothing surprises me. But I think some people who maybe haven't experienced that kind of wild life, it does surprise them. And they'll think, oh, everyone's basically this. And it's just not true.
No, I had a borderline client, diagnosed previously before they saw me. And they actually, the first thing that came out of their mouth was, my parents were wonderful to me. And they learned from the time I was 3 not to fan my flames. And you're going to have to learn how to do the same thing. Don't fan my flames. And I was like, ooh. You're going to have to learn that if you say something like that to someone like me, you're not going to get invited back to my office. Yeah. So we're going to have to restart this conversation and create some parameters here. And they loved that they could be challenged that way. But
they respect it. They respect that.
That's not something that everybody would say to them. Most people would say like, oh, well, are you sure that your parents were wonderful? Or they're going to try to look for that trauma, that wound. When this person was pretty self-aware enough to say, I get what I want. You're going to give it to me too.
Right. And you shared some stories about that in your book too, I think, of some of the people that were doing things pretty similar.
Yeah.
And I guess the other thing you just made me think of too, the self-aware narcissist community out there, that there's a
Yeah.
bunch, there's more and more of them growing now, and I have my thoughts about many of them.
Mm-hmm.
But what are your thoughts on them?
So I don't know that I can say, and I don't want to say with certainty, whether someone who claims to be a self-aware narcissist is in fact self-aware enough. I don't even really quite know what that means, because I would say, if you're like, let's say you're neurotic and you're aware that you're neurotic, and then you start responding to interventions that don't make you neurotic, you're not a self-aware neurotic, you're just no longer neurotic. So I would say, why isn't a self-aware narcissist just claiming to be a self-aware person? So are they a recovering narcissist? Are they a former narcissist? Like, it kind of confuses me what that even means, and I haven't done enough research in it to know. There are some people who meet the criteria for personality disorders and then no longer meet it. So I know they exist. I've met them. I don't consider them a self-aware borderline or a self-aware avoidant. I just consider them no longer meeting the criteria for borderline or avoidant. And they've done enough resilient work where they don't regress. Right. So I don't know what that means. I'm going to be honest. Okay. I would say, if somebody's, I would wonder why somebody would still want to identify that way if they have, conquered the pathology.
That's been my thought. And my thought has also been, if they're going to continually say it over and over again, like, you're sealing that into your brain. Yep, yeah. I'm a narcissist. And just my belief system, like, I'm really big into mindset. Mm-hmm. I would never tell someone to do that just for that reason. Mm-mm. But I think they're also doing it because of what I say narcissists are all about. And you can tell me if you agree with this. I say a lot that narcissists are all about power, control, image, narcissistic supply, and avoiding accountability. And if you look at all of their actions and you boil it down, it will fit into one of those five.
Yeah, agreed.
Okay, so you agree with that.
Yeah, totally.
And so I've had some of them, I think they're talking to me, they just haven't said it yet, but they'll say, no, we don't want to control people because then we get bored of them. And I was like, well, you're just talking about one aspect of control. There's controlling of other things, controlling how you're perceived. There's all sorts of versions of it. Mm-hmm. So what my suspicions are, for many, not all, is that they're just getting power, managing their image, and getting supply from all the likes and the views. That's my thought.
I think that's reasonable to think.
And so, I mean, and if they really wanted to do well, eventually maybe there would be, like you said, I'm no longer the self-aware narcissist. I'm just I'm a person improving. And maybe that's another thing to go over too. Now that we know there's a big genetic component, would there be able to be differences in the neuroimaging of someone that improves, you think?
Yes. They've done studies like post-therapy in children who are narcissistic. I know that's a taboo topic. I think that's, I say it's a taboo topic in my book. But, they're out there. And after certain effective interventions, they've done brain scans, and the structure and functioning of the brain is altered in a positive way after the right interventions in narcissistic children. So again, genetics don't mean destiny. Now, if you're dealing with a 60-year-old narcissist versus a 3-year-old one, I think there's going to be some habitual kind of conditioning where those traits get a little bit more fixed. But by no means, with the exception, according to experts, other than, I'm not talking about myself, according to research from experts, the antisocial, the psychopath, there's typically not like an intervention that works with them. Treatment is ineffective. But some narcissists, neurobiology, the deficits and impairments can be reversed or fixed.
That makes sense to me. Mm-hmm. And someone who's been traumatized, do their brain scans begin to look similar to that of a narcissist? No, they don't.
I mean, they're similar in the sense that there will be alterations, like damage essentially, but there aren't differences in, so a narcissistic brain, again, we're talking about trait deficiency in excess. We're not talking about nervous system deficiency in excess. We're just talking about two different things. I mean, it really is two different things. It's the difference between a trait and a learned behavior or an emotional response to a significant event.
Yeah, that makes sense. And it's good to have that distinction too. The same way with the person who is in a relationship with a narcissist, it's like, is this a pervasive pattern throughout all of your life that you're doing this?
Right.
Or is it just specific to this relationship? Like,
Yeah.
you have a good self-worth in every other area, but then all of a sudden you're with a narcissist, and before you know it, you've been like, you're depleted, and all of a sudden you don't believe in yourself at all anymore.
Right.
So
Well, and then
it's a good distinction.
Another thing to I think that will be helpful for people to know is a lot of people get accused of being narcissistic who aren't. And so they might be reacting or operating in a relationship that is exclusive to the relationship because they are reactive to that dynamic. But in every other area of their life, they are not being accused of that. And so it's not pervasive. It's not enduring. It's not an enduring pattern. It's very, very much situational. And so that's not how narcissists operate. They can turn it off and on as far as image management and being covert, but they can't actually stop having the trait in one situation versus another. Like a narcissist can play act at a funeral and a wedding and whatever else, but they really still do have those traits. And it's just a matter of how well they're concealing them.
That's a good distinction too, because I know I've mentioned before about how they can be a different person behind closed doors than they are in public. And it's really just them like maybe not masking is not the right word, but they're concealing
for sure
those traits.
Yeah, they're great at it. So are psychopaths. They're wonderful at it. I mean, they're charmers. They're very good.
Right. That makes sense.
Mm-hmm.
Well, I think that's really all the questions I had for you. I was going to ask you another one about the personal experience and expertise one, but I think you covered that pretty much, but unless you wanted to go over that too. So you've mentioned how personal experience doesn't necessarily mean you'll be going to be able to help someone.
Well, okay. So the example I give in my book is I had a borderline narcissistic relative, my grandmother. Me experiencing her and experiencing the impact of that did not make me a personality disorder expert. Although I have that personal experience of what it's like to be on the receiving end of that, that doesn't necessarily mean that exactly what I learned and discovered and what worked for me is going to work for everybody else. So I think it lends a hand to that being able to help resonate with individuals and empathize with them. Absolutely. But I guess what I'm trying to emphasize is you still need training. However, like whatever you want to call that, whether it's like you can't just wake up one day and say, I'm an expert and I'm going to go save the world. You do need to kind of know how to do that. And so that's all I was really trying to say. I'm not trying to say that people who have been victims of this aren't experts. I mean, they have to become experts to survive it, in my opinion. So it's just, that doesn't mean that everybody's cut out to be like a professional helper. Just like I'm not cut out to be a surgeon or an oncologist or a nurse. I don't have the credentials for that. I could have an ardent desire to help people. That doesn't mean I should go like walk into a hospital and say, hire me. So that's
I totally agree with that. And I think a lot of it, it comes back to humility as well. And I think me personally, I'm for whatever helps someone. Right. So whatever method is going to be good for them and they find something that works for them, I'm all for that. And I think a big difference I see among some people is the helpers or professionals, they need people to do it their way. This is the way.
Yeah.
And I'm skeptical of that personally. I think it lacks humility, and there's a certain amount of selfishness in that where they think, oh, this is the way. You don't do it this way, you're doing it wrong.
Yeah, there's a lack of flexibility there.
Yeah. And so I think as long as people have that humility and the openness to learning and the openness to being wrong about things and changing their stance on things once they're wrong, there's that political quote they say, when the facts change, I change my mind. What do you do?
Yeah.
Right. So that's how I try to be in my own life. And I think if more people were to be that way, it'd probably be better.
I agree.
All right. So I think that's a good place to end here for today. Is there anything else you wanted to cover?
No, I appreciate the time, and it's been fun.
I had a blast. I think we went over a lot of good stuff, and it's a good part two to that first one we did. And where can people buy your book?
It's on Amazon, Barnes and Noble. There's an Audible version too, and then you can go to my website and if you want more information on the book or anything else.
And Dr. Peter Salerno on Instagram.
Yes.